Hello, hello. I am double checking that I am live. Let's see. I think so. Oh, Levi. Hello, hello. Good morning. Good morning. It is Wednesday morning. Let's double check. I am live. Good. Hello. How are you? I'm good this morning. It was a little hectic. We had a delivery come through at our house today, and they give you the time window, and so they gave us the time window originally of 8 a.m. to 8 p.m. Then they gave us the time window of 9 a.m. to 1 p.m. And then at 8:15 I got a text message saying that my delivery would be here in 15 minutes. I had just gotten in the shower, so hopped out of the shower. Then 45 minutes later at 9 o'clock, they still weren't there, so I went and took a shower and got another update that they would be there at like 9:45. And then they got there at 9:30. So all in all, it was fine. It worked out, but it was a little hectic for a few minutes. Nothing I can't handle, but I don't like not knowing. So anyway, good morning. Hi, it's Wednesday. I am talking today. I am continuing the 5-part series talking about why what you're doing isn't working for your pain relief. And so today I'm talking about cortisone injections. And so over the years, since I was in physical therapy school, since I, have worked in a physical therapy clinic and everything, I see a lot of people who get cortisone injections. When I worked in Rhode Island, I was the physical therapist for the Comprehensive Spine Center there, and I worked very closely with the spine doctor there. He didn't do any surgeries. He was conservative measures only, and a lot of the people that he worked with were getting cortisone injections in their back or another kind of steroid. It's mostly cortisone, so that's why I use the term cortisone. He also did medial branch blocks, nerve blocks, and radio frequency ablations, where they burn the end of the nerve to make it so that you don't feel that pain there anymore. So I've seen a lot of people get injections. I also have seen people get injections for rotator cuff problems, knee arthritis, meniscus problems, old ACL injuries, hip problems, labral tears, hip arthritis, a few in the ankle for old ankle sprains, where else? Frozen shoulder. But I'd say the majority of them have been for knee, back, or hip problems. And that tends to be the kind of thing that I work with people with anyway. Definitely a lot of shoulder stuff, but that just seems to have been less over the years. Anyway, so I'm talking about why cortisone injections might not be working for you right now. And so one of the first things is you didn't get the cortisone in the right spot. This is mainly for back related problems. So because in the hip, the shoulder, and the knee, if you're putting it in the joint, it's going to swish around the whole joint. Your back is made up of many, many joints, and the doctor gives their best estimate of where they think your pain is coming from. So we learn in physical therapy school, the physicians learn where they went to school, these things called dermatomes and myotones. And so what that means is it's the nerve that goes to a specific spot on the skin for a dermatome. So derm is skin. Like a dermatologist deals with skin. So dermatome is the spot on the skin that gets sensation from that specific nerve. So if you're saying you have pain in a certain part of your body, then maybe the pain's coming from the joint, maybe the pain's coming from a muscle, maybe the pain is coming from that nerve root. So in the back or in the neck, I should also say in the neck as well. So in the back, the physician takes the best educated guess as to where the pain is coming from based on where the pain distributes through the body. So for example, you could have some pain coming from C7 is a common spot. And so C7 gives sensation to part of the hand. Okay, so the middle finger and part of the ring finger here mainly. So if somebody's getting zingers down into the back of their middle finger here, and they also have neck problems, okay, well, maybe that pain's coming from C7. Let's do an injection there. And there's a little overlap with every nerve root. So maybe it's actually C6 or C5. They're guessing, making an educated guess based on research that it's C7. But they're still making an educated guess. So let's say you have more generalized pain coming from your neck or your back, and it's not just the specific spot on your finger that bugs you, it's more the whole hand, more of the arm and things like that. So there you say, okay, well, I still think it's coming from 6 or 7, so I'm going to do 2 injections there. Well, if they're wrong, your injection's not going to work because they didn't put it in the right spot. And they mention that to you, you know, we're giving our best guess. I really believe it's coming from this spot, but people can be wrong. So that could be one reason why it is not working for you. It's not the right spot in the neck or the back. And then talking about hip problems, well, hip problems and back problems can mimic each other. Is it coming from the hip? Is it coming from the back? Is it coming from the pelvis? Maybe the SI joint, something like that. And if the doctor makes the best educated guess that it's coming from the back and they give you an injection in your back and it doesn't work, well, maybe it was actually coming from the SI joint, or maybe it was actually coming from the hip. And so if they put it in the wrong spot, it's not going to do anything because it didn't hit the origin where the pain is coming from, where the pain is originating from. So that could be why your cortisone injection is not working. It's not getting in the right spot. Another reason that that cortisone injection isn't working is it's not localized inflammation anymore. So let's give an example of knee problems, knee pain. Maybe you have knee arthritis. You've been getting injections, cortisone injections in your knee for years. In the beginning, you were noticing that your knee was pretty swollen. And then over time, it was pretty swollen. And so you get a cortisone injection, and the cortisone injection takes away the pain, takes away the swelling, feeling really good. Then you wait another, you have to wait at least 3 months before you can get the next injection, but you're feeling really good anyway. So you put it off and you're feeling good for 3 or 4 months. And then month 5 comes around and it's coming back. It's a little swollen, not as much. So you get another cortisone injection. Helps with the pain, helps with the swelling. And then you go in this cycle over and over and over again where you feel pretty good for a couple of months and then you don't feel good for a couple of months. And then after a while, you're noticing, you know what, my knee hurts. My knee isn't swollen anymore. And so you get a cortisone injection in your and it feels different. It kind of worked this time. Now I'm just going to give it a little bit more time. Days go by, weeks go by. The knee still doesn't feel quite right. Not as good this time with the cortisone injection. What happened? Well, the inflammation that the cortisone helps with probably is not localized to the knee anymore. Yes, you have inflammation, but now it's systemic inflammation. So that means it's going throughout the whole body. So a process that happens is with inflammation, your body is trying to fight off an infection or an irritation. If if it's not an illness type of thing, if it's more of an arthritis, it's an irritation that creates friction and creates some swelling. Well, over time, your body has been sending so many reinforcements to your knee that inflammation and inflammatory reaction gets out of control. And so now you have inflammatory markers in your bloodstream, and your blood goes throughout your whole body. So now your body starts thinking that there's inflammation, or excuse me, that there's a problem in more places in your body. So now it's creating inflammation in other parts of your body as well, sitting in your bloodstream, sitting in your lymph system, and just coursing throughout your body. So you aren't necessarily swollen. You might be a little bit swollen. And so now you have this systemic reaction, this chronic inflammation that is no longer acute. It's no longer localized to one area. So if you get a cortisone injection in your knee, maybe it will help a little bit because it calms down that very small amount of chronic inflammation that's in your knee. Plus they give you the numbing agents. That's going to help just a little bit anyway. But again, the pain is caused from an inflammation throughout the whole body. So doing an injection in your knee isn't going to help. But wait, if it's inflammation throughout your whole body, won't your whole body hurt? No. Your knee's a weak point. It's been injured before. It's had the problem before. Our body almost tricks us into thinking, oh, the pain's only there. I have a whole other story about how our body tricks us with pain. Like, have you ever heard that a heart attack, one of the symptoms is pain going down your arm? Well, that's because your body, the nerve, talking about these dermatomes, myotones, and you also have ones that go to your visceral organs, the nerve innervations there. So pain down the arm for a heart attack. Why does that happen? Well, you've never had a heart attack before, so your body doesn't know what pain in the heart is like. It does know what pain down the arm is like. The dermatome of one of the nerves that goes down your arm is the same as the nerve that goes to the visceral organ, the heart. So your body, your mind, your brain thinks that you're having pain down your arm because historically that's where pain has happened. It has not happened in the heart. So your body tricks itself. Same kind of thing to a lesser extent can happen throughout the rest of the body. You still have pain in your knee because it's a weak point. Historically, your body has had pain there. It's more likely to have pain there again if you tweak it or anything. And it's where your body thinks that you have pain. So your knee really hurts, or maybe just the pain in your knee is more than the pain that's coursing throughout the rest of the body. You can also have other symptoms of inflammation coursing throughout the body. Not going to get into that now. Okay, so those are two reasons why cortisone might not be working for you. You didn't get the injection in the right spot, specifically for the neck or the back, and the inflammation that the cortisone injection is helping is no longer localized. It's more systemic. So it's not going to work if you put it just in your knee, but the inflammation is coming from the whole body. Okay, so those are two reasons. Another reason that the cortisone isn't working is you rested too long after the cortisone injection. You're supposed to rest for a certain amount of time after the cortisone injection. It's really not that long. Some doctors say a day, and some doctors say longer. And really, what do they mean by rest? They mean don't do any extravagant activity. Don't go for a run, especially if you haven't been running in years. Don't do heavy weightlifting, but you're allowed to do your normal day-to-day activities. So that involves walking. You're allowed to walk. You can go to the grocery store. You can go up and down the stairs. You can get on and off the floor with your grandkids or kids. You can do what you would normally do. So for me, that would involve going for a daily walk. So I would be allowed to walk for a mile or two, nothing crazy, probably slower pace, but they don't want you doing any crazy activities. Part of that is because you're numbed up and they don't want you getting more hurt because you can't feel any pain there if it happened. So some people think that that's rest means that they have to lay on the couch all day. That's not the case. I used to have patients come in, they got an injection 3 o'clock on a Monday and they were in therapy at 10 a.m. on Tuesday, and we were doing exercises. We weren't doing anything crazy. I mean, we never were doing anything crazy, but we were doing some movements. A little bit of movement is good. Swish around that cortisone to get things moving and grooving. So that could be why your cortisone injection is not working. You rested too long. You didn't do anything. You didn't let it swish around in the joint and really get all aspects of that joint. Okay. So, and then lastly, this one's a big one. I saw it a lot when I worked in the spine center. And the reason your cortisone injection might not be working is you didn't coordinate strength training with that cortisone injection. So the cortisone injection is going to help with pain and inflammation if it's in the right spot, just as we talked about before. But that might not be the reason why you have pain and inflammation. Let's say you have an injured knee. Let's say you have arthritis in your knee. So not necessarily an injury, just normal wear and tear that happens. Arthritis, I love this phrase. I don't remember who said it, but I love it. Arthritis is wrinkles on the inside. Everybody gets wrinkles as they get older. We get wrinkles in our skin. We get wrinkles on the inside. We get arthritis. It doesn't mean it has to be painful. Okay. So let's talk about, we have arthritis in our knee. We get a cortisone injection in our knee. Well, we can have pain-free time period with arthritis. So what caused the pain? Well, some friction caused the pain because the friction caused inflammation, which caused the pain. Why did we get friction? Well, we got friction because our knee's been bothering us for so long. So we haven't been doing as much activity as we normally do. So we got weaker. As we got weaker, our knee was changing position. Maybe we were becoming more knock-kneed. And then that's going to put added pressure on part of the knee that didn't have as much added pressure before. So if you do a cortisone injection, but you don't strengthen, so you're no longer working on, if you don't strengthen so that you're no longer walking with that limp, well, in another couple of weeks, another couple of months' time, you're going to need a cortisone injection again. And so it's going to seem like it didn't work. When in fact, if you had strengthened your hips, your ankles, and the muscles around your knee, maybe you could have stopped walking with a limp, stopped that friction, stopped that inflammation, stopped that pain. So that could be another reason why your cortisone didn't work. When I worked in the Comprehensive Spine Center in Rhode Island, I used to tell patients all the time that the cortisone is giving your body pain relief so that you can move in the way that now your body needs to move to stretch or strengthen, right? So I used to see people who had back problems a lot, and they would hear, oh, well, I need to strengthen my core and I need to stretch out my back to feel better. But they were in too much pain to do that. Well, the cortisone injection is going to calm down the pain. So now you can get into those positions because now it's less painful. So now you can stretch out, you can strengthen. And I do make a point that it's more of the strengthening aspect. I think for the most part, we stretch a bit too much. We need more strength. That's another topic for another time. So there we have it. Some reasons why your cortisone isn't working for you. Why what you're doing now, cortisone series, isn't working for you. So you didn't get the cortisone in the right spot, so it's not going to do anything because it didn't get to the origin of the problem. It's not localized inflammation anymore. Now it's throughout the whole body. You rested too long after the cortisone, or these kind of go together. You didn't do strength training coordinating with that cortisone injection. So those are the reasons why what you're doing now isn't working. And I invite you to continue asking me questions because that gives me some fuel to come on and do some live trainings, answer your questions in an easy format. Everybody else gets to benefit from the question as well. And I am also doing a live training. It's 90 minutes next week, Tuesday. It's a new one. I did one in December. I have done them before, and this one is continuing on this topic a little bit of why what you're doing isn't working and what you can do about it. So I invite you to join me next Tuesday, 1 p.m. Pacific, 4 p.m. Eastern, for a 90-minute live class to get some answers to some of the questions that I've been hearing often. I would love to see you. I will post the link there to sign up in the description or in the comments of this live video. Otherwise, I will see you guys soon. Have a great rest of your day.